Okay, Jenny again from America, keeping you up to snuff on what I'm finding in this wonderful Facebook site here. Incredible. I encourage everyone to go to this. This is concerning child N. This is, I'm going to read it to you. Basically, it's just absolutely disgusting. This is the hemophiliac baby. It was there for quite a while, a number of days. And again, I'm going to deep dive tomorrow into the medical things. And it wasn't just that it was born and then had some problems. It was there for a long time before it started having issues. No reason they could not have transferred it. It was 34 weekers with a mom that was a known carrier of hemophilia. Did take a little while for the blood work to come back. It did not have. It did not have. They did not have enough factor VIII at the pharmacy. They had some, but they didn't have enough. They told him it was, as his kid was bleeding, they were saying it was going to take a few more days for them to get it in. Unbelievable. It actually had intrauterine growth restrictions, so it was, don't think of it as a 34 weeker, as a normal size 34 weeker like my daughter was. She was a 5-pounder. This baby wasn't anywhere near that. And so it was restricted growth. Again, and here is where Dr. A, the quote unquote boyfriend doctor, who testified against her, Lucy, and basically tried to get in her pants. Okay, let's just be realistic with here. This is where he absolutely screwed up. Okay, so basically, the deterioration begins with bleeding, not collapse. So the bleeding and then the collapse. The blood was noted in the oropharynx, that's the back of the throat, the NG tube around, that's 2:50 in the afternoon. In a hemophilic infant, this is immediately clinically significant. Airway difficulty. Vocal cords were difficult to visualize. Okay, an LMA airway was placed. I will show you what that is in a thing. In fact, Brewery wanted to send this kid with this LMA airway, and I think Aero Park, I don't know if it was Aero Park or Alderhay said, oh, no way, Jose. But it took a while for them to, a few hours for them to get the ENT there. In fact, but noted when I'm looking at the medical literature, it took them a few hours before they even called for help. So this baby took a while, and this baby ended up with some issues too. Now, 3 mils of blood doesn't seem like a lot for you and me, and it wouldn't be for you and me. That's basically, just think of a regular syringe that would give you a flu shot, and it would be all the amount in that syringe. That would be a 3 cc or 3 mil syringe. But for a little tiny baby, that's a lot of blood, a lot of blood. Now, succinylcholine scares the shit out of me. That's that paralytic agent. They don't use this for the death penalty in America. They use the long-acting, the pancuronium. I cannot say it. But anyhow, this is a short-acting. Dr. A shouldn't have been anywhere near that. Now, and they also gave it morphine too, and we're going to show you the problem with this. Morphine dose this is what a normal dose should be for a baby that was that baby's size. It got 10 to 20 times higher. No wonder the kid collapsed. It was overdosed on morphine by that disgusting Dr. A. Dr. A, who was and I'm not going to call him Dr. A. I'm going to call him the jerk. He was within weeks or months of getting to be a consultant and a consultant in a nice hospital. Don't worry, I know who he is. And just an FYI, I saw a picture of this cretin. He looks like, God, it's disgusting. He's He's just ugly looking. And I'm sorry. And I'm speaking as a 65-year-old woman who hasn't aged as well either. But, a serious case of male pattern baldness. He looks like like the Alps. I hate to say this. He looks like Mr. Bean. And I love Rowan Atkinson. But again, Rowan Atkinson loves to make out the fact that he looks like a bit of a nerd. But this guy looks like Mr. Bean with male pattern baldness and glasses. And let me tell you, he has the personality, when I'm reading the text, of Pepe Le Pew. I'm going to put into the description there what Pepe Le Pew is. I don't know if you all have had the wonderful opportunity of having seen Warner Brothers cartoons, the Bugs Bunny series. If not, I'll show you who Pepe Le Pew is. So anyhow, he has the personality of Pepe Le Pew. So look at that. So further airway manipulation, and I think it was like several registrars tried to intubate this baby. Several consultants screwed up on this. Look at that, rapid physiological collapse. These were the oxygen saturation. 80 is scary, and that's death. And then it went to bradycardia, which is low heartbeat, crashed. See, now in neonates, morphine has a prolonged and unpredictable half-life, particularly at high doses. Now, let's add to the fact that we know there are sewer gases that are leaking into the neonatal unit because it's got what? Manhole covers with direct communication to sewers. Hydrogen sulfide, that's screwing up with their lungs. You mix it with morphine. What the hell do you think is going to go on? So significant respiratory depression persists for hours, and you gave this baby a paralytic to paralyze its diaphragm? Look at this. Look at this. So remove LMA, they removed the LMA in a baby who had opioids on board, blood in the airway, demonstrated difficulty airway anatomy. It apparently had something in its trachea, one of these kind of weird trachea things. Look at that. And this kid ended up, I think, with brain damage. Progressive desaturation, cardiovascular arrest and resuscitation. I believe they gave this baby a total of like 5 or 6 doses of adrenaline. Oh God, I hope they gave it in a central line, because in previous babies, they gave it into if they gave adrenaline, they gave it into a peripheral line, which causes severe vasoconstriction, meaning it closes off the blood vessels. You can only give this in a central line. Had those babies survived, they probably would have lost its hand and/or fingers. Look at that. All of a sudden, it got too much volume. And we do know with Baby O, it got a lot of volume too. And Dr. A was there too. And I believe Brewery was here too. The combination of those two is... Now, Factor 8 was given, but apparently was not precedent on stock and had to be ordered in. It was more doses supposed to arrive on Friday, despite this being Wednesday. They knew this kid was hemophiliac, and he was there for a while, so he could have easily been transferred out in my unit, neonatal unit. Now, maybe we might have held on to this baby if it showed no signs of bleeding for a while and did all the blood tests. But as soon as we found on the blood test this kid had hemophilia, that would have transported it out. But we definitely would have called the Children's Hospital and, saying, hey, there's a possibility, be on alert. We may need to transfer you a hemophiliac baby. We will hold on to this baby as long as it is stable. Just be aware, we're waiting for blood tests. We definitely would have done that, because I know our neonatologists would have called the Children's Hospital and spoken to a pediatric hematologist. And that is the type of doctor that deals with these type of blood disorders. Now, just an FYI, the hematologist that testified at Lucy's trial, her name begin with a K. Right now, I'm having what I call a geriatric brain fart, and I can't remember her name, but she said this baby only had a mild version of this. It doesn't matter if it was mild or severe. The baby was bleeding and had an airway issue, and they gave it 10 to 20 times more of morphine they did. That was Dr. A that did that, guys. Okay, so look at that. I mean, just look at that. Oh, just look at that. Look at that. I am just so disgusted. Absolutely so disgusted. So what I'm going to show you here is what that airway is. Okay, just hold on just for a second. That's what that airway is. Do you feel confident that Brewery said putting that in? Well, at least they put that in, but he apparently put it out. Look at all that. Look at that. Do you feel confident that the Countess of Chester guys know what they're doing with this? All right? Now, granted, it was a last-ditch effort, but this baby should have been transferred out days, if not weeks before. And they had to go to this, and they had to wait till they got an ENT in to do it. They waited a while before they even called Alderhay or the transport team. And then it took a while. Of course it took a while for them to get there. And they had to wrestle up an ENT doctor to sit in the car or something to come there. I mean, you know, the children's hospitals, ENT, ear, nose, and throat doctors, they're taking care of other patients. They literally cannot drop what they are doing and run to another hospital. All right? Whatever doctor had to come and rescue them, and that's the device there too, was leaving the patients at that hospital without proper ENT coverage, just to cover for the fact that the Countess of Chester wouldn't transfer this baby. Now, I am going to give the Countess of Chester a little bit of leeway here. They may, I don't know, they may have called and tried to transfer this baby. But as we know with other babies, Liverpool Women's Hospital was saying no. Arrow Park didn't have enough cots that it was supposed to under regulations. And we also know that Alderhay was having a lot of surgical issues, guys. The people that were in their OR had to do a grievance to the CQC saying they're expecting us to do procedures that we're not qualified for. Equipment there was broken. They were having major issues sometime around 2014, 2015. And I don't think they got their shit together by the time this baby was around either. So either way, it is just absolutely freaking mind-boggling. Now, the bleeding for baby E, that was the gastrointestinal bleeding. Now we have bleeding now through in the airway, and we do know about the bleeding that occurred with baby O with the puncture of that liver. God, it's not only poo, but it's blood. I mean, I feel like I should call up Count Dracula to donate some blood. Oh, again, this is just getting so disturbing.